Well, it's been warmer, at least for a few days, and that might have some of you thinking about getting outside, being more active, but it is important to do that safely. This afternoon, we have Mercy Health Cardiologist Khalid Minhas to go over some things to keep in mind. Thanks for being here today. We appreciate it.
Appreciate it.
So some people, let's face it, they may have hibernated all winter long and they've been inside and they haven't been super active, and now all of a sudden we want to get out and we want to go for a run, we want to do some gardening. What do we need to keep in mind if you suddenly pop that energy level up?
Yeah, you use the right term, hibernation, and if you are not an activity person during winter time, then certainly starting activities with the weather, you have to be cautious, especially if you're taking medications for blood pressure or cholesterol. So there are some anecdotal data that there are some spike in strokes and heart attacks during springtime associated with the clock changing and the sleep pattern changing, and also with the activity that people who are not active otherwise during winter time suddenly go out and start doing the gardening or other exertional work without any transitioning their body into and tune it into more exertional work. It is important to start slow and gradual.
Baby steps. Yeah, some people, the heart's going, oh, what's happening here? I haven't been working this hard in a little while. So what kind of advice would you give to people who are saying, you know, I do want to be more active this time?
Yes, so first of all, everybody knows their body and they know their history, medical history by that I mean. And if you know that you have high blood pressure or you take medicines for diabetes, and especially if you take water pills, then going outside in the warmer weather, you need to understand that you need to stay hydrated. And that's number one. Number two, know your limitations. Start slowly, gradually, build yourself up to the activities, outdoor activities. And especially if you have any sort of risk factors, know those risk factors and understand how to cope with them.
Yeah, what are some risk factors? I think we talk about knowing our numbers.
So there are, for cardiovascular disease, the most important thing is genetic predisposition, which we cannot do much about. However, there are other risk factors, including diabetes, high cholesterol, blood pressure, smoking, stress, lack of sleep. All these things in collection contribute towards build-up plaque in the arteries of not only in the heart, but also in the brain and rest of the body. So you need to work on each and every one of them accordingly and know how to maintain your diabetes, your blood pressure, your cholesterol, stay in touch with your physicians, regular visits. Knowing your body, knowing your numbers is very important, in addition to stress and sleep, which are underemphasized, but they're very important in our general well-being overall.
And it is something that we can do something, we can prevent. You know, we can get more sleep and we can manage our stress, even though it does seem hard at times. These are things that we can take into consideration, unlike the genetic dispositions.
Yes. Your personal discipline, going to bed on time, and keeping your technology, cell phones away from your bedroom, and trying to go to sleep early and get a good night, 8-hour sleep. That's extremely important for not only for your physical health, but also for your emotional and mood well-being.
And you talked about knowing your body too. So, and I think especially for women, when it comes to heart disease, our symptoms, that might present a little bit differently than in men. When we know if you have a heart attack, you're feeling that pressure. It presents a little different for women. But if we, know our body and keep on top of when we might be feeling off.
I'm glad, Amanda, you brought this up, because women especially, we just had a heart month in February, and there's more and more emphasis on understanding, because heart attacks are #1 killers for women. And women, in the traditional studies, initially, even in textbooks, this was kind of ignored, gender in cardiovascular healthcare. So more and more people are understanding it, knowing it. There's more awareness about it. Especially in women, they try to ignore and not downplay their symptoms. They need to understand that it's better to get help earlier. especially in this area where we have a lot of farmers and women, they present late for their heart attacks. So if you have symptoms, don't downplay it, don't fight out, just go out and get checked out with your physicians and especially your cardiologist.
Yeah, take care of yourselves, and as you mentioned too, hydrate as the weather warms up. Thank you for keeping this top of mind for us today. We appreciate it because we are going to enjoy the outdoors. We're going to.
Yes, it's absolutely good times.
Yes.
It's very good to go out and enjoy this, enjoy the warm weather, but at the same time know how to use it best for your body.
Yes.
To your body.
Absolutely. Great advice. Thanks for being here today.
Thank you
Yep.
so much, Ms. Amanda.